Well, this fall, Governor Andrew Cuomo announced more than $25 million in federal funding that would help address the state's ongoing work in combating the opioid crisis. More than a dozen counties classified as high needs will receive a portion of that funding, including Monroe and Wayne counties. I recently spoke with the commissioner of the New York State Office of Alcohol and Substance Abuse Services to get an idea of where things stand in the Empire State and helping people access treatment, services, and recovery support. Here's a look at my conversation with Commissioner Arlene Gonzalez-Sanchez. Commissioner, it's been reported that opioid-related deaths in New York State are not slowing down right now in spite of efforts to combat this epidemic. And I'm curious, what is the state doing differently right now than in the past to address this issue?
So, you know, I just first want to say that depending on what data you see or you get, you have different information. So in some areas it says that it's sort of like plateauing, and in other areas it seems to be controlled. So it's not that it just continues to go up. It just depends on what data you gather. But nevertheless, you know, even if you have one person still dying from an overdose of opioids, we take that extremely seriously. In terms of what we're doing everything and anything possible to really address this epidemic. We're looking at treatment services, we're looking at expanding existing treatment services, ensuring that our regulations are flexible enough that gives people access to the treatment that they need. But we're also looking at prevention and recovery support to maintain people stable in their communities. We're also looking at innovative models, your non-traditional models, models that, you know, are just really geared towards treating the population that we're treating, which are very transient and do not do well in going into a clinic and staying in a clinic.
When you look at Monroe County, for example, and I'll give you some of the latest stats that we have from our task force here in Monroe County, 769 reported overdoses and 110 reported deaths as of September 6th of this year. So when you look at stats for our region, what are some immediate causes of concern for you?
Well, of course, the immediate concern is, you know, when I see those numbers, I mean, people dying, my first thing is, why? The question is why? What is it that we need to do more to avoid or to at least reverse these numbers? And so with that focus in place, that's why particularly in Monroe and the Finger Lakes, we have really focused on developing a lot of programming. I mean, Monroe got the CODI, which is the Center of Treatment Innovation, with some dollars we got from the federal government to develop the mobile treatment capacity and the telehealth. You know, we've also implemented some peer support programs, family navigators, clubhouse programs in that area to try to combat and get our arms around what is going on in Monroe and in the Finger Lakes area.
Commissioner, when I talk to individuals in recovery and I've interviewed their families, there is one consistent thing that I hear, and that's, yes, there are prevention efforts, yes, there are treatment efforts, but we need long-term follow-up care. That is critical to help individuals not relapse. And I want to know if there's any type of focus on this within the state, specifically when it comes to long-term support for those in recovery.
Absolutely. If you look, we have developed over 17 recovery support centers throughout the state, and we will continue to open more recovery support centers. And that's exactly what family members and others have been saying. And I agree, which is why we have focused on ensuring that we just don't only focus on treatment and prevention, but that we also focus on the recovery supports. So there are centers, recovery centers, where people who are in recovery could go to get that support that they need from their peers. It's not treatment, it's not clinical, it's a place where people go and they could, you know, be around peers that are going through, have gone through what they've gone through, and will help each other maintain their stability and sobriety.
And Commissioner, do we have any of those recovery support centers here in Monroe County?
Yes, I believe, yes, you do.
Okay. Are there systems in place within the state in terms of really monitoring and tracking this funding that's coming in, whether federal funding, whether grants, in terms of determining if prevention and support services are in fact working?
Well, actually, everything that we're doing, we are looking at outcomes. And so, yes, the state is tracking outcomes. Everything, all these programs, everything that we're developing, we are really focusing on the outcomes, because that's the only way we know whether we're really addressing the issue appropriately. So yes, the state is tracking the outcomes to all these programs.
That was Arlene Gonzalez-Sanchez, Commissioner of New York's Office of Alcohol and Substance Abuse Services. For more information or to get help, please go to combataddiction.ny.gov.